Welcome to This Week in Dermatology. This week we are covering 10 notable papers spanning advanced management strategies for skin cancer, novel therapeutic insights in atopic dermatitis, and optimizing procedural and wound care outcomes. Let us dive in. We begin with atopic dermatitis, where new real-world data are helping clinicians optimize long-term maintenance and tailor therapies for specific patient populations. First, a retrospective study published in the Journal of the American Academy of Dermatology evaluated the feasibility of tapering the oral Janus kinase inhibitor, abrocitinib, over 24 weeks in 78 patients with moderate to severe disease who had achieved an adequate clinical response. The investigators compared two tapering methods, dose reduction in 36 patients and interval extension in 42 patients. Tapering was remarkably successful, achieved in over 97% of patients, with non-relapse rates of over 97% at week 12 and 91% at week 24. This strategy led to a mean cumulative dose reduction of nearly 10,000 milligrams and substantial cost savings. However, clinicians should note that patients who extended their dosing intervals had a significantly higher rate of strategy switching due to disease fluctuation, at nearly 29% compared to just over 8% in the dose reduction group, suggesting that lowering the daily dose may offer a more stable tapering course than spacing out doses. Meanwhile, in clinical and experimental dermatology, a multi-center Italian study evaluated the real-world effectiveness and safety of the interleukin-13 inhibitor lebrikizumab in 90 elderly patients aged 60 years and older with moderate to severe atopic dermatitis. Over 52 weeks, the mean eczema area and severity index decreased dramatically from over 23 at baseline to under 3. The proportion of patients achieving a 75% improvement in their severity index rose from 58% at week 16 to 87% by week 52, with similar responses across age groups regardless of prior biologic or Janus kinase inhibitor exposure. Adverse events were rare, occurring in fewer than 8% of patients and remaining mostly mild, confirming that lebrikizumab is both highly effective and safe in older populations. Next, we turn to basal cell carcinoma management, highlighted by two key publications from Acta dermato-venereologica. In a massive nationwide registry study from Denmark, analyzing over 130,000 tumors over an 8-year follow-up period, researchers compared recurrence rates across different treatment modalities. For nodular basal cell carcinoma, standard surgical excision demonstrated the lowest rate of recurrence, with an 8-year cumulative recurrence rate of 16.5% and a 20% lower hazard of recurrence compared to curettage. For superficial basal cell carcinoma, standard excision and curettage performed equally well, both showing an identical 8-year cumulative recurrence rate of 16.3%. A machine learning model identified facial location, larger tumor size, a high number of hospital-registered diagnoses, and close proximity to a dermatology clinic as key predictors of recurrence. Addressing the economic and resource implications of surgical selection, another study in the same journal compared healthcare resource utilization and direct costs of Mohs micrographic surgery versus traditional surgical excision for high-risk facial basal cell carcinomas. While Mohs micrographic surgery was associated with higher initial costs, it led to a slower accumulation of healthcare costs over time. Crucially, patients who initially underwent traditional surgery but subsequently failed and required Mohs surgery incurred the highest total costs, often after undergoing multiple prior procedures. This highlights primary Mohs micrographic surgery as a highly cost-efficient strategy for high-risk facial lesions by preventing expensive downstream failures. In a related safety assessment, a study in the Journal of the American Academy of Dermatology explored skin cancer risk, specifically in systemic sclerosis patients who have undergone organ transplantation, emphasizing the need for heightened surveillance in this medically complex cohort. Moving to therapeutic safety and wound care, we examine a systematic review in clinical and experimental dermatology that quantified the risk of acneiform eruptions associated with deucravacitinib, a selective tyrosine kinase 2 inhibitor used for chronic plaque psoriasis. Analyzing 14 studies representing over 5,000 patients, the researchers found that nearly 9% of patients developed an acneiform eruption, with acne making up over 70% of these events, followed by folliculitis at 23%. Across controlled trials, patients taking deucravacitinib had more than 4.5 times the odds of developing these eruptions compared to those on placebo, with higher odds observed at greater daily doses and in patients treated for psoriasis or inflammatory bowel disease. Fortunately, these events rarely led to treatment discontinuation, occurring in only 0.2% of patients, meaning reassurance and standard acne therapies are generally sufficient. In the realm of wound care, the PLOS Medicine Journal published the Venous Ulcer Study 6, a pragmatic randomized controlled trial across 33 sites in the United Kingdom, comparing compression wraps and 2-layer compression bandages against standard evidence-based compression, which includes 4-layer bandages or 2-layer hosiery, for venous leg ulcers. Among over 600 participants, 2-layer bandages demonstrated non-inferiority to standard evidence-based compression under a treatment policy strategy, with a hazard ratio of 1.01. However, compression wraps actually resulted in slower healing times compared to standard evidence-based compression, with a hazard ratio of 0.78, and did not show superiority to 2-layer bandages. Although the trial was limited by frequent treatment departures and lower than expected overall healing rates, the findings suggest that compression wraps are unlikely to accelerate healing compared to traditional bandaging or hosiery. Finally, we highlight several diagnostic and procedural advancements. To improve the detection of non-bullous pemphigoid, a 10-year large-scale retrospective case control study established clinical predictors and developed a novel diagnostic nomogram to aid clinicians in early identification. For procedural guidance, another study demonstrated that evaluating the compression response during ultrasound imaging helps clinicians achieve real-time differentiation between pseudocysts and active tunnels in patients with hidradenitis suppurativa, offering a practical bedside tool to guide surgical and medical decisions. Additionally, a new technique utilizing near-infrared vascular mapping was introduced to guide the procedural management of superficial cutaneous vascular lesions, enhancing precision and minimizing complications during targeted interventions. If you only have time for one paper this week, make it the nationwide Danish registry study on basal cell carcinoma recurrence, published in Acta dermato-venereologica. This landmark study of over 130,000 tumors provides invaluable long-term real-world data confirming that standard excision remains superior to curettage for nodular basal cell carcinoma, while establishing that curettage is highly comparable to excision for superficial variants. Here are the key takeaways from this week in dermatology. First, when tapering abrocitinib in stable atopic dermatitis patients, reducing the daily dose is associated with fewer disease fluctuations and fewer strategy switches than extending the dosing interval. Second, lebrikizumab is highly effective and well tolerated in elderly patients with moderate to severe atopic dermatitis, showing progressive improvement up to 1 year regardless of previous systemic therapies. Third, while most micrographic surgery carries higher upfront costs for high-risk facial basal cell carcinomas, it is highly cost-effective in the long term by preventing the substantial cumulative costs associated with traditional surgical failures. Fourth, deucravacitinib therapy significantly increases the risk of mild to moderate acneiform eruptions, but these events are manageable and rarely require treatment discontinuation. Finally, for venous leg ulcers, compression wraps do not shorten healing times compared to traditional 2-layer or 4-layer compression systems, which remain the preferred standards of care. That is your roundup for this week in dermatology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary for clinical decisions. Always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.